As a naturopathic physician, some of the patients that we see, their problems are pretty straightforward, but others are very complex and very chronic, long-lasting. And that's where we have to investigate each system. So we have to look at their mood, their digestion, their neurotransmitters, their endocrine system, their structural integrity, and where they have pain. When we have somebody that has basically multi-system dysfunction, we will oftentimes start with the diet in terms of first eliminating foods that we find to be allergic or irritating to their system, enhance their digestion, and then with that we're also looking closely at their hormones. How is their thyroid functioning, their adrenal, is their liver fatigued? And so this combination of endocrine assessment and fine-tuning is key for people finding their vitality. Neurotransmitters and moods are another category where we're able to do some testing and evaluate if people have sufficient amino acids and neurotransmitter levels in order to feel healthy and happy and motivated. And then the structural component in terms of where they have pain and if they're on pain medication, and are they exercising in order to get those naturally occurring endorphins. So through this multi-system approach, we're able to reestablish people's health. And the key to it is working with people as a coach at the pace at which they are able to proceed. Some people are able to just jump right in and work on multiple things at once. But many people are more systematic, and so we go at their pace in terms of changing their diet. And we introduce the neurotransmitter piece once their digestion is cleared up. And then we work on the pain, maybe one joint at a time, if they have a knee, a hip, and a back pain. Whereas others, we go more aggressively. They want to get things done quicker. So we're adaptable to the patient's need in order for them to find their whole health.